The Ebola crisis in Sierra Leone has taken a new twist on Wednesday. Burial teams in 2 districts have gone on strike over pay, raising the risk of the virus spreading even faster. Workers say they haven't been paid weekly risk allowances for at least 2 weeks. The government says the issue will be resolved within days. Meantime, the head of the U.S. Centers for Disease Control says there are real signs of progress in the fight against Ebola. Speaking to VOA at the CDC headquarters in Atlanta, Georgia, Tuesday, Dr. Thomas Frieden said this includes better training, more understanding of the virus, and safer practices, including during burials for Ebola victims.
I think all of us who've traveled to the region have just been stunned by how bad the situation is and how rapidly it's changing. The things that are changing for the worse are the number of cases and the fact that our systems there are still overwhelmed, particularly in Liberia. But things are also changing for the better. We're seeing a more robust response, we're seeing a more organized response from countries, we're seeing focused action, and we remain confident that we can turn it around.
Frieden said there are no new cases in Nigeria and the outbreak in the Democratic Republic of Congo is contained. He also said there is a decrease in the number of new cases in parts of Liberia, one of the hardest hit countries. The U.S. military is spending $750 million over the next 6 months to battle Ebola in Liberia. 2 new mobile medical laboratories were deployed last week, and 4,000 U.S. service members are being sent to the region.
The real critical thing to this, based on the USAID and the CDC, is to get about 70% of the personnel that are infected into a treatment facility. And then at that point, they believe the curve will start going down. And then it will be based on how fast and how effectively, 1, the curve turns down, and 2, the international community can then pick up all the requirements. So we're going to stay as long as we're needed, but not longer than we're needed.
Nigeria has not had any cases of Ebola for more than a month after initially confirming 19 cases and reporting 8 deaths starting in late July. Health officials are praising the country's health services for their quick response to the crisis. But as VOA's Jeff Swicord reports, people in Lagos are vowing to stay vigilant.
At the Apapa Port Complex in Lagos, Nigerian health officials board the 180-meter Pintail, a Cyprus-flagged cargo ship with 19 Ukrainian crew members. By order of the Nigerian government, each crew member's temperature is taken and recorded in a manifest.
This is the Ukrainian.
Ruslan Bosenko is the ship's captain.
Temperature again and again. It's what we can do. This is our health. We must make all precaution.
One of the largest ports in Africa, the Apapa complex docks 50 ships a day from around the world. Health officials must board each one and take the crew's temperatures. Part of the new normal as Nigeria fights to keep back the Ebola virus from entering the country again. Dr. Faisal Schwab is the incident manager of the Nigerian National Ebola Emergency Center.
Even as we seem to have gotten a hold on the outbreak in Nigeria, the fact that the disease continues to rage in other West African countries means that we can't let our guard down.
That sentiment is echoed throughout Nigerian society. The Mopeth Pharmacy in the upscale neighborhood of Akoi is taking measures to guard both the health of employees and patrons.
And the small one is how much?
Each customer's temperature is taken upon entry, and a hand sanitizer dispenser is being installed by the door. Efimi Nuego is the assistant pharmacy manager.
Okay, first and foremost, we have responsibility as a community pharmacy to take care of the public as well as our staff. Our priority was to make sure that our customers who came in here felt safe.
Hand sanitizers are in demand around Lagos. At one point, there was a shortage in the city. Computer engineer Michael Yupong stopped into the pharmacy to buy another bottle.
I feel like protecting myself. The documentation says that if you wash your hands or if you use sanitizers, then at least you're protected. So right now it has become like a habit. Everywhere you go, you find everybody with a sanitizer.
At the Adishoba household, hygiene has become priority number 1. Zainab and her 3 children are constantly washing their hands and using hand sanitizers. She worries about her children and the contact they will have with people outside the house.
The kids are being taught how to take care of themselves, wash their own hands too regularly, take their bath often, and avoid body contact with people they don't know, strangers.
In a deeply social country where greeting a friend with less than a handshake was once considered insulting, change has not come easy. But for now, caution rules the day. Jeff Swicord, VOA News, Lagos.